You're all welcome. I think we can get started. Today's webinar is focusing on uniting forces for MNCH advocacy impact, and we particularly want to highlight and also shine a bright light on a few game changers that will be shared with the team today. I want to thank you on behalf of everyone who's here, who's been behind the scenes preparing for this event, for making the time to join us today. Thank you so much for taking the time to join. We believe this is an important discussion and we are happy that you are part of it. Please note that there's an option for interpretation of today's session in French. If French is your preferred language, please click on the global icon in the toolbar at the bottom of your screen and select your preferred language. In case you're having any challenges, please let us know in the chats and the team will be able to give a response as we go on. We are happy to note that this is the third of a series of webinars, and I am delighted to be moderating it. My name is Dr. Betty Mirembe. I work with PATH in Uganda as the country director. I have more than 20 years of experience in public health practice. 15 years of those were spent in managing programs focused on HIV/AIDS, maternal, newborn, and child and adolescent health. And I'm happy to be part of this very important discussion today. As we start this meeting, please take a minute to post in the chat where you're joining us from. We would love to know where you're joining us from, which institution you're representing. We believe and we're expecting a lot of representation from government, development partners, donors, members of civil society from all over the world. And we believe this will be a very rich group of individuals. We want to thank all of you for being here and for all that you do for women, children, and communities in general throughout Africa and beyond. We hope that through this session, we can network, we can exchange knowledge, and we can learn from others in advancing MNCH advocacy at the country, regional, and global level. Thank you so much once again for joining this meeting. For those of us who are not very familiar with PATH, allow me to take a few minutes to introduce to you who PATH is and what we do. We are a global team dedicated to achieving health equity, so all people, communities, and different groups of people can thrive. We are more than 15,000 strong and global team experts all over the world, and we work in over 70 countries globally. Our work focuses on many things, but I'll just highlight a few. We focus on product development, contraceptives, rapid diagnostics, and other devices. We also have a very big focus on primary healthcare, people-centered healthcare services, and system strengthening. We have been involved and are still involved in vaccines and essential medicines, development, formulation, manufacturing, and rollout. We also do a lot of work around digital transformation, particularly within electronic immunization registries and other real-time systems. We also do work around epidemic preparedness and response, disease surveillance, responder training, and coordination. And finally, we are also involved in advocacy and communication. We focus work a lot on elevating community priorities, influencing local and global stakeholders. And we are really glad that you're part of this meeting today. We also believe that as PATH, that together we are able to drive public health solutions that meet the most pressing needs of families, communities, and our countries. And although we work in many countries, we also thrive in partnership. And we know that one of the key things today will be for us to build those partnerships and keep working together as we progress in this advocacy work. Let me provide a bit of background around the advocacy and discussions that have been going on within this webinar. This is a third, as I mentioned, and we're really glad that you were part of it, and also happy that maybe a few of you are even joining us for the third time. We all know that despite significant progress in MNCH over the past decades, many countries, particularly in Africa, are still struggling to meet the SDG targets related to maternal, newborn, and child health. And current trends indicate that over 80% of countries are unlikely to meet their national maternal and mortality targets. 64 of those countries are projected to miss the neonatal mortality target, and 59 of those countries, some of our countries, will fall short of the under 5 mortality target by 2030. There is therefore an urgent need to accelerate progress towards achieving the targets for maternal, newborn, and child health. And despite the progress that we have registered as a group, as partners working together in reducing maternal and child mortality, there are still significant disparities. They have been persistent, particularly in low and middle income countries. We believe, and we've also seen, that coalitions play a vital role in addressing these challenges by utilizing resources, expertise, political will across sectors and borders. But we also believe that we bring different strengths to the table, and we are hoping that we can continue to do that even as we work together to make sure that our countries are able to meet the targets. I'd like to also point out that we only have 6 years left to 2030, and that means we have a lot of work to do in the coming years. So what are our objectives today? The webinar today will give us an opportunity to highlight advocacy partnerships that have shown promise in ending preventable maternal, newborn, and child health. And as you will hear in a few minutes, I have a couple of colleagues that will be sharing their experiences from the different places where they work, and we will be in a good place to hear and learn what has succeeded and what we can take on away from this meeting. We are also hoping to strengthen partnerships among communities, governments, international organizations, and civil society to accelerate reduction of preventable maternal and newborn mortality. As I mentioned earlier, we believe that partnerships are key, and they are really, really important for us to move forward. But before we dive into our discussions and before I invite the panel, I'd like us to have a few minutes on our mentee session. Can we please have the slide up? Please go to www.mentee.com and enter the code and provide your responses to these questions that I will pose just now. In your view, and based on where you are, what are the challenges you have encountered in working with MNCH coalitions? What are some of the biggest challenges you have encountered in working with MNCH coalitions? The second is, please share any outcomes you've registered as a result of working in MNCH coalitions, and kindly mention the country where you've been able to achieve those results. I hope it's working for you, and looking forward to seeing your responses. The screen says 0 responses so far. I'm hoping we are just trying to connect. Can we have a thumbs up for those that have been able to connect? Some reaction of sorts, so we know. Okay. The biggest challenges I'm seeing, funding for MNCH coalitions is limited. We agree, it's been limited in many places. Yeah, funding is still coming out, financing, We're also seeing lack of a shared agenda or goal. Yeah, it's possible, and it's been our biggest challenge in many areas that we sometimes pursue different courses of action or lines, and we tend to have a challenge in augmenting whatever we are doing. Yeah, I hear you on conflict, competition. Yes. Lack of coordinated efforts. Time to commit to partnerships. I see coordination coming up. So we're hearing a lot of funding, coordination, conflict. And I think funding has been significantly highlighted. Can we go to the second question? Yeah, there's a comment coming up that some of the responses are not comprehensive and are not uniting. Yeah, there's another point coming up in the chat that projects are time bound, and after their implementation, intervention stops or comes down significantly. The second issue I'd like to hear your thoughts about is, can you share any outcomes you've registered as a result of working in MNCH coalitions? Those of you that have been a part of MNCH coalitions, please share some of the outcomes you've registered. Okay. We see some interesting fact here: increasing funding for recruitment of health workers in Uganda. I think this should continue because we still have an HR gap. Completing an investment case that contributed to increased funding, very important outcome here. And I hope we were able to move to the next stage of being able to fund the investment case. Increased political will, very important for our work. Newborn roadmap for humanitarian settings and the creation of the newborn field guide. Yeah, that's important. We need all those set in place for us to work. I'm seeing some inputs in French, and we'll get those translated so that everyone can know what their comments were. Capacity building, important. I hear dissemination of new guidance on NC, PNC. That's critical. I think guidelines need to be developed, need to be adapted, and also need to be taken to the next stage. Thank you so much for all your contributions. Please keep them coming so that we can get to know what some of the outcomes that you've registered. And I think it's a note to encourage everyone that we can be able to achieve some successes. I hear a request in the chat for a translation of the presentation. I've shared it with the team, and I know they will take care of that in a short while, or probably by end of the meeting. The last one I will read for this time is sensitivity to the children and immediate family. And we believe this is important. As we keep speaking, we keep sharing the message, and we get a connected agenda or process. Allow us to move on, but as I mentioned, please keep your ideas coming. We may have a few minutes at the end to continue highlighting what some of our challenges are. They may seem to be collective challenges, and maybe we also may be strengthened by some of the achievements that have been reported. Our speakers for today's session are very important, but they are people that have been part of this space for a long time. And allow me to welcome Dr. Alemu, who will be sharing with us from the WHO side. He is the Ramnak advisor at WHO, and allow me to introduce him in a few minutes, and then I'll hand it over to you for your slides. Dr. Alemu is a medical doctor with postgraduate qualification and specialization in public health and international health. He has extensive clinical experience and expertise in the design, management, and leadership of maternal, newborn, and child health programs at both national and international levels. He has a broad background in the UN and other organizations. Dr. Alemu has provided high-level support to countries in the WHO Africa region in the areas of reproductive, maternal, newborn, child, and adolescent health. And currently, he's the advisor for RMNCH in Uganda, the United Republic of Tanzania, and Eritrea within the multi-country assignment teams with WHO Afro based in Uganda. Dr. Lemu, you're welcome. Please go ahead.
Thank you. Thank you very much, Betty, for that wonderful overview, as well as the nice introduction. Welcome and thank you, colleagues, for joining us. And I'm really overwhelmed, very happy to be here to share some perspectives on MNCH advocacy from the WHO side. So, as an introduction, time has always been not on our side. So we are always in the urgency to accelerate progress towards the health, improving the health of mothers and children in our continent specifically. Each day, or let me say it, each second, each minute, each hour, there are voices that are being silenced because they die from preventable causes. And for that, this team aligns with the drive for accelerated action towards those global sustainable development targets, which every country is really looking for. But for the African region, again, Betty, thank you very much. You have given a very good overview of the dire situation where many countries will not be able to achieve these SDG targets in the given time frame, particularly in Africa. So that is really the reason we need to advocate. Advocacy in its simplest term is working together, common journey towards a common goal. That is how I would like to introduce today's presentation. Next, please. So how is it in the African region? Referring to maternal mortality, we can see that given the current situation, in the given rate of acceleration or rate of progress of reducing maternal deaths, the world will fall short of SDG goal 3.1, which is particularly focusing on reducing maternal deaths by more than 1 million lives. This is really, really significant. Achieving 70 maternal deaths per 100,000 live births for many countries in Africa is really elusive. That is why the 154th session of the Executive Board of the World Health Organization really brought up the issue of accelerating progress towards these goals, 3.1 and also 3.2 for children. Because we see Sub-Saharan Africa contributes only 30% of live births globally, but 57 to 60% of deaths in under fives is contributed by Sub-Saharan Africa. So this is really, really very, very dire. And next to Sub-Saharan Africa is South Asia, which is not really in good terms in terms of maternal mortality rate. Next. So what are the trends when we come to Africa, particularly the WHO African region? You can see in the graph that we have all, I mean, there have been significant achievements, but we still are far from where we need to be. You can see the two lines past 2020, we are still beyond, I mean, maternal mortality ratio is above 500 per 100,000 live births. And these deaths are mainly coming from hemorrhage, postpartum hemorrhage in particular. And if you go deeper into some countries like Liberia, Chad, South Sudan, where different conditions overlap each other towards the misery of our women and children, maternal mortality ratio goes even beyond the regional average. So we really need to accelerate this reduction in the coming few years to really see the results that we need to see. Next. So survival gains have slowed and acceleration is needed. Why? Because if you refer to maternal mortality ratio particularly, we need to accelerate 11 times from the annual average rate of reduction of 1.8 to 20.3 if we have to achieve the SDG target within the coming 6 years, which is really, really very elusive. For stillbirth, we need to accelerate 5 times. For neonatal mortality rate, we need to accelerate 6 times. And for those between 1 year and below 5 years, we need to accelerate 5 times. So you can see from these figures the immense amount of work that this region is really needed to work towards. Next slide, please. So what are the key areas for intensified advocacy? Now we have seen how the situation is. So from our perspective, there could be many, but in terms of coming to focus, we really would like to pinpoint 3 areas. Health systems strengthening, which is the core component of dealing with any health sector in any country. If you don't have a strong system, that means you cannot provide services. That means you cannot coordinate partners. That means you cannot really do good at policy and program level. So strengthening health systems would be vital, specifically in the areas of workforce capacity, infrastructure, and supply chain management that are really behind every bottleneck that is concerned, as far as this concerned when dealing with health systems strengthening. These are necessary to ensure timely and equitable access to quality MNCH services. In some circumstances, you can see substantial increase in coverage of services, substantial increase in implementation of the different aspects of the plans that we do. But when you come to the impact level, nothing changes. That is because quality is always at the center, and it is compromised across the health systems. The second area we need to focus is equity and social determinants of health. Again, I quote Betty. She has really briefed in her introduction that the vulnerable groups, the marginalized groups are really the ones that are being left behind. So equity, which also relates with the social determinants of health, is an area that the advocacy efforts that should touch in any progress that we make. This is really necessary because, you know, it also extends the work that we need to do. Health sector itself, it cannot really address everything. And if you have to deal with social determinants of health, you need to go beyond the health sector and work with other social sectors and infrastructure sectors that are concerned with improving the health of their population. Innovation and data-driven decision-making. What is now, there are emerging issues in global health, especially in the area of policy. They are saying that if you don't have quality data, if you don't analyze those data, if you don't keep them to the level of quality that you need, even if you analyze them, they will inform you falsely. This means as you go up, if you use low quality data, it means you are using the wrong information and it will end up informing the formulation of wrong policies or policies that would not address the required issues. So another area of advocacy for us is to really focus on data for decision making. Next. So partnership. Again, I would like to quote Betty. And I really would like to thank Paz and also other partners that have always stayed in the journey, in the walk, the talk with WHO, because without partnership, you cannot really do a lot, especially in the arena of advocacy, resource mobilization, all the necessary milestones and blocks that you need to build require strong partnership, particularly in accelerating MNCH outcomes. But here, I think we all agree if I say government ownership comes in the driving seat. It should be governments that must lead priority setting and mobilize resources. We as partners are only potentiating as adjuvants to the work of governments. In so doing, we need to have clear roles and responsibilities, but under a shared ownership, under a shared goal. Again, thanks to your responses, participants. One participant particularly mentioned the issue of really not having shared goals. That is really coming from the issue of not really having clear roles and responsibilities in the global arena. Policy and financial commitment, again, is key because you have again stated that resources again and again are the issue behind those creating challenges, and prioritizing MNCH in national budgets towards mobilizing sustainable domestic financing is an issue that we also need to focus during when strengthening our partnership. The other very big block is community. Every approach that we make, every effort of advocacy should be community-centered. And again, we most often forget the learning and adaptation process, which is key. What works in one country might not work in another country, but that is okay. Again, we don't really focus on learning from failures. We always talk about best practices, what has taken some country from here to there. In so doing, we often forget the failure aspect. Failures are also, platforms for learning. Peer-to-peer learning networks, dissemination of best practices, flexibility are issues that we need to consider. Next slide. So what are WHO's approaches for maintaining MNCH on national and regional agendas? Sustained political engagement. I have mentioned that governments are the ones that should be running the priority setting and policy agenda. What we need to do is to really position ourselves and in the MNCH block aligned with universal health coverage and sustainable farm financing. Monitoring and accountability frameworks, again, talks back to the data-driven decision-making that I discussed, tracking progress through country-specific scorecards and regional dashboards at each level, not just at national and regional level, but sub-national level. Leveraging global movements, we strongly engage in and are the driving force in every woman, every child agenda, but also continental movements like campaign for accelerated reduction of maternal mortality in Africa, which help maintain visibility and momentum when we do advocacy work. Next. Collaboration with civil society, again, as the leading agency for health, WHO collaborates with different partners. One of them is civil society in the areas of advocating for policy change. We do a lot of research. We do a lot of normative and standard setting, but all of that comes through collaboration with civil society, because civil society are the ones that are at the national, regional, or grassroots level, and they are the ones that influence these policies that promote equity, access, and quality in maternal and child health services. We also collaborate with civil society in mobilizing resources, advocating for domestic and international funding, but also innovating financing mechanisms within countries, such as pooled financing and other aspects of health financing. Service delivery and monitoring is our other area of collaboration. CSOs provide direct services and support underserved populations, but in that doing, they really need the support from WHO and other partners that support them in policy and standard setting. I know there are issues when, as you go from country to country, different approaches could be there in terms of, setting service delivery standards, but those have been one of the wrong approaches countries have been following because of the interest from donors and other partners. But a standardized approach, a standardized service delivery model is one that WHO really supports CSOs in providing services and monitoring their effectiveness. Next. So, my 2 cents in calling for action, this particular meeting today. Again, I would like to underscore the urgency of accelerating progress towards maternal and child health gains, but this requires our collective responsibility, and it doesn't differentiate one partner from the other, one voice from the other. So we have to be there collectively. This is to say that we need to unite efforts. We need to leverage innovations in this era of advancing technology, but also we need to keep vulnerable populations at the forefront. I think with that said, I come to the end of my presentation, and I would like to thank Paz for really giving me this honor and opportunity. Over to you, Dr. Betty. Thank you very much.
Thank you very much, Dr. Lemo, for that very, very important presentation and showing us where we are, particularly highlighting the fact that we don't have all the time. And I think the call to action cannot be stronger, the urgency with which we need to work, but also the fact that we need to unite as advocates to be able to move our agenda. I'd like to remind us to post our questions or thoughts in the chat, and we'll have some time to look at them later. And also think through what we have done, but also what Dr. Lemo has said, and begin to jot down a few things that we probably haven't done and would hope to do after this webinar. We will now want to move on, and I want to take the opportunity to invite our second speaker, Christine Yakama from Kakamega MNCH Alliance. Christine is the founder and coordinator for Good Health Community Programs. She's a zonal leader for Kakamega MNCH Alliance. She's a budget facilitator. She's a RAMNAC champion and member of the Kakamega County Education Board, representing child rights organizations. And as a champion for maternal and newborn health at the subnational level, Christine, kindly share with us what strategies you find effective in fostering partnerships to advance maternal, newborn, and child health advocacy and accelerate outcomes at the subnational level. and also what have been the opportunities and challenges you have encountered in uniting forces for improved MNCH outcomes at the subnational level. Over to you, Christine, and welcome.
Thank you so much. Good morning, good afternoon. Some of the strategies that we've been using to advance maternal, newborn, and child health advocacy, we've been using the social audit. Here we are using the community scorecard and the public expenditure tracking, where we've been able to strengthen health systems to respond to the needs and priorities of women and girls. 2, we've been working with community health promoters, pushing for their stipends, as well as we are making use of their integrated communication services during health programs. 3, we've been partnering with the county and national government, County Assembly, Path Kenya, UNICEF in developing policies. Some of the policies that we've been able to develop are the Kakamega County Maternal and Family Planning Act, whereby mothers should attend foreign visits and also access health facility to deliver in health facilities, skilled birth deliveries. And then we also have the Improvement Financing Act, whereby money is being collected in health facilities and it is retained in the health facility. We've also been able to measure progress towards ending preventable maternal mortality, whereby we've pushed and bid for formation of sub-county and county maternal and prenatal death surveillance and response committees at health facilities. We've also been improving the availability and effective use of data on inequities and the effect on reproductive and maternal health. Here we are using the PATH MNCH asset tracker, whereby high quality maternal, newborn child and nutrition health services are not possible without access to essential medicines, devices, and interventions referred to as assets. Next slide, please. Opportunities for improving maternal, newborn child health outcomes. The county government responsive, we are able to meet the county health management team. We are able to work with them in developing annual work plans, as well as influencing key budget documents like the county budget review and outlook paper, the county physical strategy paper. Alliance members have been integrated in technical working groups like the reproductive, maternal, newborn child, adolescent health technical working groups, and also the NCDs one. And then we are able also to train healthcare workers on budget making process and also developing triage assessment tool. Healthcare workers were not informing the county overall budget. They were making budgets according to the money that they received from the county budget. Now it became a challenge. On triage, we used to have challenges, especially on delayed entry to care, poor documentation, insufficient client triage to identify emergencies. So we were able to develop the triage assessment tool, which we are able now to reduce the massive maternal deaths. We have Linda Mama program, Imarisha Afya ya Mama na Mtoto, and community health promoters. Linda Mama is a program that the government has initiated where mothers are not paying for going to health facilities to deliver. Imarisha Mama na Afya ya Mtoto is a stipend that is given to mothers when they attend the 4NC visits. And community health promoters from the households to the health facilities. Our referral system is that ambulances are not able to go to households. They are doing referrals from health facility to health facilities. We are helping healthcare workers in identifying critical ill children and referring them for timely treatment. Here we are using the TIMC the team see the tools for integrated management of childhood diseases, whereby now they are able to appropriately screen, diagnose, and manage severely sick children and know how to refer them. Next slide, please. Some of the challenges that we're experiencing is there's the lack of funding to support the Kakamega MNCH Alliance activities. A few members of Alliance have already withdrawn. The county government and members of county assembly need motivation to participate in our activities. So what we do, we normally make use of when they're having their committee meetings is when now we are able now to extend our involvement or participation in their activities. And then members of the Alliance need a refresher training so that we are up to task, because at the moment things are changing, especially in things to do with budgets and also public participation. Over to you, thank you.
Thank you so much, Christine. Thank you for really highlighting your strategies and the opportunities that are available. And I know that teams are also looking at your strategies and seeing which ones they can use and which ones they can take forward. There are some 2 questions that have come up. I will share them with you, and then we will have a bit of time later to respond. Christine, there is a question around how easy is it to access data to support your advocacy at subnational level? I think there are people who are wondering how easy is it and what have you done, because they see from what you have shared that data is really critical. And for Dr. Lemu, there's a question for you as well. I'll read it out so you can prepare to respond to it later. For a long time, WHO has been more focused on technical guidance and supporting data generation to support countries. Why the sudden shift and focus on advocacy? Do you see a duplication of roles with other agencies that are traditionally known to support advocacy? I'll leave that with you, and we'll probably get it back to it later. We just didn't want to miss them. Allow me to move to our next speaker. Our next speaker is Amos Mwale. He's the Executive Director of the Center for Reproductive Health and Education in Zambia. Amos Mwale has over 20 years of experience in advocacy for reproductive, maternal, newborn, child, and adolescent health. And Amos has served on various advocacy and accountability platforms at the global, regional, and national levels. His current roles include the Global Advisory Council for UNFPA, and he is the outgoing CSO representative on the Global Financing Facility Investors Group and the co-chair of the Advocacy and Accountability Working Group for the Reproductive Health Supplies Coalition, and has recently joined the Advocacy and Accountability Group under the Every Woman, Every Newborn, Every Initiative, formerly ENAP EPPM. Mwale, you're welcome. Please take it on.
Thank you so much, Chair. Good morning, good afternoon, good evening, colleagues. And I think for me, I'm very much glad and excited that the discussion that we are having is very much interlinked and connected. So when you look at the discussion, that I'll just carry on from where my 2 colleagues have already left off. So one of the things that I've been asked to look at is how do we ensure that we keep the commitments running? So what we've learned over time that I think it's very, very important that we have consistent meetings at country level, regional level, and also global level. So for instance, we are ensuring that the existing committees, so let me go to the country level. So we have in most countries, the technical working groups. We have the coalitions. How are these coalitions actually ensuring that whatever meetings they're having, every woman, every newborn, everywhere is something that is being discussed. So for us, we've made sure that all the discussions that are going around are centered on saving women, saving newborn. That's practically what we are doing. Secondly, we've also ensured that we are being board. I think being board is very, very important. We've noticed that sometimes governments tend to give excuses in terms of why they are not allocating resources. They are talking about priorities, competing. But I think it's important that whenever we have these excuses, we are able to push with them. We are able to push back to say, look, it's very critical that we save women, because there's nowhere else where we are going to find these resources. I know we are doing domestic resource mobilization. We are advocating for domestic resource mobilization. And when the resources that come through, how do we ensure that those resources are actually aligned with the work that we are doing? So that's one of the things that we are trying to make sure that it's done. And this is being done through coalitions and through technical working groups that are already existing. I need also to mention that one of the things that, I mean, as a challenge in terms of ensuring that we keep these commitments alive at country level has been competition. I think competition is one of the things that is drawing us back. It doesn't save our women, it saves ourselves. So it's important that when we are working at country level, I understand that we all want to show our logos, we all want to impress our donors, but that is not helping. So one of the things that we are doing is we are trying by all means to ensure that we lessen as much competition as possible. There are some countries where we've seen that once there's very much committed leadership, we are even able to see where the resources that are being directed. So with that, we are hoping that once we are able to see more from our partners and ensure that these partners, we are all working the same line, we'll be having less duplication of work. We'll also have a very good system of reporting where everyone else within the coalitions and technical working groups are speaking the same language and we are using the similar database. I think that will also help us ensure that we keep these commitments. Okay, now coming to the next question, which I was asked to look at, where I was told, like, how do we ensure that these strategies are actually working? So for us, we make sure that we strengthen partnership. I think we've heard from the previous speakers that it's very, very important that we have a strengthened partnership with one government. How do we ensure that government is working across, with all the civil society, with all the community members? How are these stakeholders also working in line with the community members? We've just heard from our colleague from Kenya in terms of how the community is actually pushing to ensure that service delivery is reaching them. How are we as civil society or stakeholders ensuring that the resources that we have are actually helping these community members push for services to actually reach them, to save the women and the newborn? Secondly, we are also working to ensure that we leverage on the existing resources. That is very important. These resources, right now, I'm sure everyone else has seen and noticed that we have very much scarce resources. So we are ensuring that resources that are available are being utilized to not only address one thing, but across the RAMCAN. I think it's important that we don't leave out other important elements to ensure that a woman is adequately addressed. If it's commodities, if it's other services, if it's reaching them at the last mile, that is being done, and it's being done with the resources that are available with the different stakeholders and different partners. Last but not least, we are also using innovation. In terms of innovations, how are we doing it? We are currently ensuring that for us to work well and the environment is safe, we are disseminating the existing guidelines. Right now, we have all changed from AWAC to every woman, every newborn, everywhere. So this is something that we are now informing everyone. We are also looking at the new WHO resolution 2077. How is that working? How can we ensure that we leverage on that for people to utilize the wording in there? It's something that countries have agreed to. So how, as stakeholders at country level, using that information to advocate with our governments to save these women? Thank you so much, Chair. This is the brief I can give on the subject matter.
Thank you so much, Amos. We really appreciate the insights you've shared. One of the things that we thought you would highlight, and I'll just read it and see if there's anything you would like to add at this time, but we are happy for you if you would like to add it on later on. What the question was, what are some of the successes you have registered over the course of time as you've been involved in this work, in this advocacy work? We can see you've had an opportunity to lead advocacy efforts at the global level, at the regional level, and also at the country level. Is there something that stands out as one of your biggest and best successes that you'd like the team to hear about? Please share it.
Well, so for me, I wouldn't claim it as my success. I think one of the things that we have seen, I've just spoken about the WHO 77 resolution. It highly talks about serving women. It's something that has been pushed in from different angles. And for us to see to it that even at WHO level now, especially in Geneva, resolutions are coming out that are supporting reproductive health, that are supporting saving women, that are supporting saving newborn, and everywhere. I think that's something that, for me, is a success that we are seeing. And I hope that it's something that we can carry as a team and use it to ensure that we save women with different angles. Thank you.
Much for sharing that very important success. And we also note that you acknowledge it's really a success that has come as a result of a combined effort. Dr. Lemo, there was a question that I'll read to you and probably will have some time later to respond to it. And the question is, what support is there for advocacy partnerships to support the implementation and accountability for the new commitments made under the recent WHO resolution on MNCH? So we'll provide some time later for you to have any responses for that question. But allow us to move on, and I'm happy to introduce Esther Nasiche, who will be our fourth speaker. Esther is the Global MNCH and Immunization Advocacy Lead under the Advocacy and Public Policy Project at PATH. Esther is a seasoned advocate for the health rights of women, children, and adolescents, with close to 2 decades of experience in public health policy, advocacy, gender, stakeholder engagement, and strategic advocacy, including collaborative work with alliances at grassroots, national, regional, and international levels. Esther has been a key advocate for maternal and child health, immunization and nutrition in Africa and beyond. She is currently the co-chair of the Advocacy and Accountability Working Group for Every Woman, Every Newborn, Everywhere, formerly ENAP/EPPM. Esther, as you come in, I just have 2 guiding questions. One of them is, I actually have one. How can in-country, regional, global advocates and other stakeholders facilitate joint advocacy action to advance every woman, every newborn, everywhere targets and improve maternal and newborn survival and health and reduce stillbirths? Esther, over to you. Esther, you're welcome.
Oh, thank you so much. I hope you can hear me. Yes, really excited to talk about partnerships and why they are even more critical now more than ever if countries are to meet the SDG targets for maternal and newborn health. From all the presentations that have been made, we right from the WHO presentation by Dr. Lemo, we can see that countries have made significant strides in reducing preventable maternal, newborn, and even child mortality. But we need to accelerate. I think he had a slide where he was talking about accelerating up to 11 times if we are going to meet the target for MMR, and 5 times if we are going to meet the target for NMR and all that. We all saw that. So we know that the road ahead of us remains really long. And so the challenges are complex. But that is why even strengthening partnerships now is critical more than ever. And so in terms of what we need to do, one of the game changers is really around ensuring that we have a shared goal. And why that is important is because for a long time, as partners, we've all been working towards, one target. We know that we need to end the preventable deaths. We know the targets because they are globally set, but we didn't have a shared goal. And therefore, the pathways were defined by all the partners as they came. Every advocacy partner decided how best they needed to reach the 2030 SDG targets, or the different targets that have been set at national level or even at subnational level. And so for now, we do have one goal that has been defined for us as advocates, and that is what is articulated in the global advocacy strategy for maternal and newborn health. And we are looking at ensuring that we unite, existing efforts for maternal and newborn health advocacy, so that all the partners from the subnational level, like Christine, who you heard from, or from the national level, like Amos, and also from the global level, like, all the others who are on the call, we unite our efforts and we come together. And so when you ask what is the goal of this work, as I move to my next slide, when you look at the goal for our advocacy at the moment, it is really to ensure that by 2030, we see strong country leadership, talk about pandemics, and of course we need to prevent them. But even whilst we have those conversations, we need to remember
I think Esther is breaking.
Esther, we are losing you. I'm not sure whether it's your connection. It seems like it's your connection. You're coming in and out. Okay, we seem to have lost Esther. What we will do, Esther, you back?
Can you hear me now?
Yes, we can. Please go ahead.
Thank you so much. So I was mentioning that one of the game changers is really the fact that we now have a shared advocacy strategy. And so we can bring all our energies together and ensure that what is happening at the community level, at the national level, at the regional level, and at the global level, comes together, because now we can unite our efforts. Let's move to the next slide. Let's move to the next slide, please. Exactly. And so as we unite our efforts, what does this mean? It means that we now know that countries need to invest more in terms of resources for maternal and newborn health. And I am excited that the countries that have acceleration plans, as they have defined them, actually have also articulated what advocacy priorities they need to focus on. And most of them have talked about investing more of the domestic resources, because we understand that, of course, the fiscal space at country level may not be that big, but also at the global level, the resources are not as they were, previously. And so we need to see countries investing more resources, whether that means, recruiting health workers, or that means, improving the infrastructure, or that means ensuring that we have commodities for women and children, and also newborns, available at the points when they need them. I think that is even more critical. And that is what, the political will needs to be translated into. But then the other bit is also ensuring that that maternal and newborn health remains on the political agenda. So that is what this advocacy strategy really helps to bring together. Let's move to the next slide. Exactly. And so when we think about this work, for a long time, you would have advocates like Christine working in their own silo, and you have national level advocates also working in their own silo, and you have global level advocates also working in their own box. And now for once, we have an opportunity to bring all the efforts together and unite our efforts and make sure that what is happening in a community in Kakamega or in Ethiopia or in Nigeria, wherever that is, aligns with the regional priorities, for example, through regional bodies like the African Union, but also that links up to the global level through, initiatives that are led by partners like, WHO, PMNCH, and other organizations. So we need to see that, coming together strongly, and that's what this advocacy strategy helps us with as one of the game changers. Let's move to the next slide. And so as part of this advocacy, the question is, it is one thing having an advocacy strategy, and we have defined that as a game changer in terms of, how we define these advocacy partnerships. But then the other bit is, how do we unite all the diverse voices? And, how do we ensure that we are united, even when, we are all focusing on different components? Because we know that there are partners that are focusing on maternal health, and they will be talking about, MMR and all that. There are partners that are focusing on stillbirths. There are partners that are focusing on the newborn. But yet all these efforts need to be united. And so we have what we call the Advocacy and Accountability Working Group that has recently been created. And that is the group that I was introduced as the co-chair. We co-chair that with UNICEF. And at the moment, it is Dr. Gagan Gupta, who I think some people on this call already know. But we are co-leading this with as PAC and UNICEF. And the opportunities for us to bring or advocate for maternal and newborn health at the national, the regional, and the global level. But as we come together, also ensure that we have accountability. Accountability for the resources that have been invested, but also accountability for the commitments that are being made. So the MNCH resolution, the MNCH resolution that Dr. Alemu referenced earlier is a new commitment that has been made. So part of this this work, or part of the role of this advocacy working group, is to make sure that such commitments do not end on paper and in Geneva, but rather we have those being implemented at the country level, and we have the impact reflected at the last mile. I think that remains important. Let's move to the next slide. And so the question is, what is difference with this working group? And this is one of the game changers that for a long time you have advocacy working groups, but they're majorly comprised of advocates. So you're basically speaking to the choir. You're basically, preaching to the choir, or basically speaking to converts already. This working group is different, and that is what we want to see in terms of the advocacy partnerships. Please keep advancing the slide. That at the moment you have community voices being represented here. You have national level advocacy thought leaders as part of this group, and people like Amos are also part of this group. You have global level leaders, like the PMNCHs and Align MNCH and others being part of this group. You also have the professional associations, because many times, like I've said, advocates speak to themselves, but now this is different because you need the professional bodies to also come together and make sure that they're contributing to the advocacy messages as you are framing them. They are part of the conversation as you engage the decision makers, whether at national level or at global level. They need to be part of the team that is articulating the messages. And then you have the research institutions. So we have the academia also as part of this group, because they are the people that are generating evidence. And then, of course, you have the normative agencies. You cannot have this conversation without WHO, without UNICEF, without, all the other partners, because they remain critical partners as the ones that are defining that are supporting to define the agenda. So when you look at the Advocacy and Accountability Working Group, it brings together very diverse voices, but at the end, it means it's a stronger partnership, because you are not speaking a language that is only unique to a certain group, but rather you bring in all the diverse voices and all the diverse perspectives, and you come together to discuss what the acceleration agenda should be. And I think that is what the game changer is. Thanks. Let's move to the next slide. And so the other bit is that many times we've had partnerships for advocacy that kind of focus at, within the geography where they are, or even if they are representing maybe regional level sometimes you don't see how that ladders up to the global level. So the game changer here is that we do have an advocacy working group that brings together the diverse voices that I have already explained. But beyond that, that is linked with all the different groups that are working on accelerating action around maternal and newborn health. And so that is what you see. The management group is part of the UN. That is the UN management group, which is hosted, of course, or sits within WHO. And you can see that advocacy is a critical group there. But then you also have the country implementation group, which is, charged with, all these guidelines and technical guidance to the countries. And then you have the group that is focusing on metrics and others. But that just shows you how important it is to ensure that what is happening at the community level does not stop there. It connects to the national level, to the regional level, up to the global level. And that is what will make the difference if this acceleration agenda is going to bear fruit. Let's move to the next slide. And so in terms of the roles and responsibilities, I have alluded to this, but now one of the critical things is the fact that we do have a strategy with a very clear work plan, and part of what this group will be charged with is implementing the work plan, so that we don't have people who are, who are just listed on paper, but we want, our hands, in the trenches. We have to be working. And so all the advocacy priorities, as they have been articulated and defined by the countries, whether it looks at improving policies around MNCH, or it looks at increasing investments, or it looks at strengthening and sustaining political will. The question is, how do we make that happen? And that is going to be part of the work of this advocacy working group. And then the other bit is, how do we make sure that all the different advocacy aspects, as they happen in the corners, in our countries, in the communities, how do they ladder up to the global level? That is also going to be the role of this advocacy working group, to make sure that we bring in, we bring the efforts together, we can measure progress, we define and also measure progress wherever it is happening. Let's move to the next slide. And this is my second last slide, so don't worry, I'm not going to take all the time. So in terms of the next steps, we've talked about finalizing and ensuring that the work plan is implemented. That is one, but also the other is defining, as part of the work plan, defining the key moments. So we know that this week the UN General Assembly is happening. Lots of conversations are happening at that level. So how do we make sure that the MNCH agenda remains, a priority when such conversations are happening? We also have key moments within the Africa region, for example, the AU Summit, the African Union Summits, and other opportunities as they come. How do we make sure that the maternal and newborn health agenda remains top? That is part of what this group will be doing. But then also beyond that, making sure that the national level coalitions, like where Amos comes from and where Christine comes from, they do have the support they need for their advocacy. Do they have the tools, for accountability? Do they have the tools to support the budget advocacy and so forth? But also beyond that, documenting the work and the progress that is being made, is also going to be important, because many times it's very easy to articulate the technical contribution to the progress, but then when it comes to the advocacy contribution, it becomes a challenge. So how do we measure the progress we are registering as a result of advocacy? That is going to be a game changer, and that is going to be what this advocacy group is going to work with. And so I think this is maybe my last slide. But just in conclusion, to say that the road ahead is really, it's really long. But if we work together, if we bring the diverse voices together to support the advocacy agenda, I think the acceleration is going to be possible. So to Dr. Lemon's slide that had, MMR, we need to accelerate by these times, still births, we need to accelerate by these percentages or this number of times. I think it is possible if we bring the diverse voices together, Civil society advocates should not be speaking to themselves alone, but let's speak to the professional bodies. Let's speak to the politicians. Let's speak to the decision makers, whether they're technical, political decision makers, because together the impact that we are looking for will be registered maybe even before the 2030 targets. So thank you so much. And over to you, Dr. Betty.
Thank you so much, Esther, for really highlighting those important pieces that we all need to take account of, the partnerships, the way ahead, and also how we can remain focused and how we can keep engaging in the national and global areas or pieces of work on advocacy that are going on. And I believe we are all mapping out where our roles would be very, very critical. We now have an opportunity to have some interactive session with questions and answers from our panelists. We have already had a couple of questions in the chat. Allow me to just quickly run through them so you have a moment to respond. And if you have any other questions, please send them through the chat as well. One of the first questions was for Christine. How easy is it to access data to support your advocacy at the subnational level? And Dr. Lemu, there was a question on for a long time, WHO has been more focused on technical guidance and supporting data generation to support countries. Why the sudden shift and focus on advocacy? Do you see a duplication of roles with other agencies that are traditionally known to support advocacy? And yeah, you have another one here. What support is there for advocacy partnerships to support the implementation and accountability for the new commitments made under the recent WHO resolution on MNCH? I don't know if there's any other, but can we have your responses? Christine and Dr. Lem will come in with the two questions. Christine, over to you.
Thank you. Accessing data is a challenge. So part of the initiatives that we are doing at the subnational level, as MNCH champions, we are using the asset tracker in health facilities, whereby now we are working with healthcare workers in level 1, 2, and 3. We consolidate the data that they have, and then before the 5th of every month, they need to submit it at the county level, so they are able to key in at the KHIS, so that now they become the same. And then there's that data now that we are having a challenge is the ones for people with diabetes and HIV, because theirs they have to until they get the results so that they are able to key in. So we normally put that in consideration, and we are working with the county government to see whether this one for the asset tracker, and as well as this one's for DHIS, and also the spiral ones, they can coordinate it and come up with something called a seamless one. It can be a plus. Thank you.
Thank you so much. Dr. Lemu, over to you. Thank you, Christine.
Thank you. Thank you very much. It was really very insightful and really entertaining, and at the same time, a very good learning platform to hear all the presentations and reflections, but particularly to these two questions, which I really take very, very well. But WHO, it is true, we are providing technical support to countries in health, but what does that technical support entail? You know, it's across the health system. It's from policy to service delivery, particularly in the area of setting standards and norms. We have normative function, but one part of it is supporting countries in advocacy efforts. We support partners, we support countries in their advocacy efforts. One key area that we address is, you know, using advocacy as a cross-cutting tool or strategy across all programs for resource mobilization. You lead resource mobilization strategy development, for example, one aspect. You can engage in advocacy strategy development, which Esther was also really giving details about. But these are areas that every partner should rally around. I don't see any specific institution or partner to have a designated role as their own only of advocacy. Advocacy is everybody's work. Advocacy is WHO's work. Advocacy is PAS's work. Advocacy is every institution's work. So we don't duplicate. Allow me to say, I could be mistaken, but one area where you don't really duplicate is when you do advocacy, because resources have never been enough. You need to rally everybody across, programs and service delivery efforts to improve not just maternal and child health, but also other program areas. So advocacy, for me, is a collective effort, as I was trying to address in my presentation. So we rally, we work with partners, we work with governments, we work with all the partners that I mentioned towards strengthening advocacy for improved impact, but not just outcomes, if I may say. In the second, which is a very good, again, very good question, in the area of supporting partnerships towards WHO resolutions, our role as WHO is not to give finances. WHO is not a financing agency. WHO is always a technical assistant, first-hand technical assistance or technical support provision to governments across member states. What do we do in terms of helping countries really realize these resolutions? Number one, we bring partners and stakeholders on board using our convening power. We bring partners and stakeholders to rally together at each level, could be global, regional, or country level. And the other area that we help countries really realize these resolutions is, in helping them understand the specific bottlenecks that hinder the delivery of services, and then particularly in averting this. We help them identify these specific bottlenecks and prioritize resource allocation towards these areas. So what does this talk about? Again, in terms of accountability for resources that Esther was mentioning. In doing so, we foster countries, or we help countries to be accountable for the resources that they get, not only the one that they get from external sources, but also the resources that we always tell them to bring and allocate for the health sector. So, accountability for resources, accountability for commitments, again, are areas that we help countries to address or realize their resolutions. I would like to mention one phrase that I learned when I was on a mission recently in Liberia. We had a UNH6 partnership advocacy mission where we had the opportunity to do some advocacy work to the level of the president. And when we met him, he said, Liberia is not poor. We Liberians are not poor. We are only poor because we don't know how to use our resources. That is true, because the quality of spending those resources matters. So quality of spending, resource allocation, and accountability for those resources are the triangle, are the corners of the triangle that I would like everybody to take home today. So, in a nutshell, there was again a regional committee meeting of the Africa region for WHO, the 74th Regional Committee meeting, where we saw some WHO's work, advocacy work, really penetrate into countries. We were able to utilize, to raise more than $40 million from member states. I was on that meeting live, and the contribution started from as low as $1,000 to millions. This is only from member states, African member states. We are helping them commit resources. We are helping them, through these resources, we are helping them, commit themselves to the people that they serve. And in so doing, it is an area where they would be able to strengthen WHO's structure, but also, hold WHO and others accountable for the delivery of the needed interventions across the MNCH life course and other program areas. I hope I have tried to address your questions, and I thank you very much. Over to you, Betty.
Thank you so much, Dr. Lemu. I know you have elaborately really provided a response, so thank you so much. Team, we have a bit of an interactive session. It will be short, but it will also be an opportunity for us to hear from you regarding the different issues that we've discussed today. Please go back to your Menti screen, www.menti.com. Please provide the slides so that they can see what the codes look like. And the question that I have for us right now is, what opportunities do you see for fostering partnerships to address current gaps in MNCH advocacy and improve service delivery? I'll take it again. What opportunities do you see for fostering partnerships to address current gaps in MNCH advocacy and improve service delivery? I see two responses so far. Funding collaborations, right? I think that has come through, although it seems to be a challenge in many instances, but I think it's the right way to go. We have corporate sector CSO collaborations. I think those are also important. And maybe we haven't fully leveraged what they can provide. The other one is leveraging ongoing campaigns, e.g. the KAMA campaign by AU. I think that's important. We need to tap into whatever it is that's going on within our areas, within the region, and make sure that it really brings some yield towards maternal health. And then I also have another one aligning on a narrative and key messages for policy makers and donors. That's important as well. I think in some instances, we are not aligned on key messages, and therefore we sort of crowd or do not speak from the same tone, if I may call it. And then tap into the acceleration agenda that countries have set. I believe we all have the acceleration agendas. We really encourage you to see how you can tap into those when you're back and at your desks. See how you can tap into those, how you can contribute, but also how you can rally other partners to really tap into those agendas so that we can make the needed steps. I know that we have resounded throughout this meeting that it's important for us to accelerate progress. And I know that a couple of the issues that you raised, the last one I'll read out is bringing in new and willing partners on the advocacy table, including WHO and UNICEF. And I know that there are probably others. And then working with professional bodies to be part of the advocacy voice. I think these exist in all our countries. Let's bring them on board. Let's bring everyone on board and let's speak the same language. Let's see which collaborations we can foster and make progress as much as we need to within the next couple of years. With that, I would like to move us to the final point. And thank you all for coming. But before that, I want to really thank our speakers for sharing your valuable insights and highlighting the importance of collaboration in accelerating the MNCH agenda. We cannot overemphasize it, but we need to keep track of how well we are collaborating in different countries. Your experiences have shed light on effective strategy for fostering partnerships, the challenges faced when working with coalitions, and also the opportunities that arise from uniting forces with diverse stakeholders to improve MNCH outcomes. To achieve the 2030 SDG targets, we must move at a faster pace and seize every opportunity to unite with the right range of stakeholders. And finally, as we come to the end of this webinar, I want to really express my gratitude not only to the speakers, but also to all of you who attended, and particularly all of you who have stayed until the end. Thank you for your engagement and thoughtful questions, ideas, and probings as we've gone through this session. Let us keep this crucial conversation going and expect to see more webinars such as this one in the coming months. And as we mentioned, your thoughts and ideas will be compiled into a draft advocacy plan for the region. And with that, I believe our time is up. Thank you again for your attendance and engagement, and have a good afternoon and a morning, depending on where you are. Thank you so much, and have a good day.
Thank you very much. Bye-bye.
Thank you. Bye.
Bye, Esther.
Bye, everyone.